pandemic risk assessment, there'll always be meetings that require people to actually get to the room. There's only so much you can do remotely. Sometimes 10 minutes in the room having discussions with people being present in the room is better than 45 minutes remotely. So there's always a trade-off to actually decide which way we should proceed. And that's a very important decision to make before the meeting actually has to take place.
Yeah, I totally agree with you. I think it's a really good pros and cons, isn't it, of digital and technology, really. Yeah, thanks ever so much. That really is nice. And I love the example you've made it really clear. And I think for me, one of the really good points you make is accessing training. You're quite right. It would have been really hard to get nearly 300 people in a room to talk about the new standards of proficiency, but we can all sit with this in the corner of our room. So it does really help. So thanks very much for that. The next change that we've made is changing a standard. And you can see there, it talks a little bit more about the use of information, communication and digital technologies. We've just changed the nuances of that, really. And I think appropriate to practice is really important to say. And I know that we've talked quite a lot, haven't we, about the difficulties with particularly confidentiality and home working and digital issues and technology, and some of the real challenges that brings to you as a clinician. And I know it's something you feel quite passionately about, particularly in your role as a fitness to practice panelist. You've got quite concerns really about this, the difficulties we all have in the boundaries really between our home environments and our work environment, and the fact that we're doing quite a lot of our work now at home, and the impact that has on this boundary between home and work. Things like bringing the profession into disrepute, for example, if confidentiality is broken in a variety of ways. And I know that we've brought together this slide with some of the things that are really important to you about working at home and confidentiality, and those are some of the key themes for you, aren't they?
Yes, Kim. I think it's important to remember that confidentiality understanding expanded over the years. I think historically, whenever we talked about confidentiality, was really talking about dealing with the paper records. We had a request, we had a patient book with all the information, and it was all about how it was stored, how it was accessed, and who could access and where it was at all times, and it was always a bit of a control. That all changed with all the digital recording. That all changed with how we access that information. And from the fitness to practice panel, my experience is that I would, from the perspective of a healthcare professional, make sure that you access the information that is relevant to your work. Yeah. As a healthcare professional, you'll have access to a lot of different applications that store patient data, they store patient information. But just because you have an access to it doesn't mean you should. Make sure that it's really, really relevant to your work and it's really relevant to the patient you're currently working on. I think we are very tempted sometimes to ask colleague, maybe even look at our own results or ask colleague to check somebody we know. This is something that should not be happening. That's a really big concern. But in terms of home working, I think pandemic showed us that we can do our work from wherever we are. We can have access to the digital information. Basically, if we have a computer and we have an internet, we can connect and we can access the information what we're working on. But that comes with its own challenges. I think in terms of home working, always look into, do you actually have a dedicated workspace location? Is it just a kitchen table when there's a lot of different materials and different information that, you know, something can be misplaced and accidentally taken or even left? How is your network security? We always hear about scammers. We always hear about hacking. This is a big thing. So make sure that your network security is on a high standard. Very likely as a clinical scientist or whatever profession you are, you might have patient-related discussions. It's not enough to say that, oh, I didn't use patient's identifiers, so nobody's going to know who I'm talking about. If you discuss patient-specific information and details, that's something the confidentiality comes in first place. You need to be aware of it. Is it really a private conversation? Who can hear you? If you have a house full of children and they can listen to your conversation, that's not a private conversation. That's not confidentiality. The same in your professions, very likely you might be working with colleagues from other organizations and institutions, simply just asking for advice. Maybe it's a new procedure that they already carry out and you're looking for some information to support you. Be really, really careful what you share with them, what kind of information you share to get the feedback from them. But I think the biggest thing is really make sure that you always access the information that is relevant to your practice.
So don't access anything, as you so rightly said, that's related to you, your friends or your family, because that can get you into quite difficulties, can't it, really? And that's something that we definitely don't want to happen.
Well, I always look at it from the perspective, well, if you were a patient, if it was your information, how would you like that to be treated? Would you like somebody just stand in the hall and talk to everybody who's there about your private stuff? Probably not. And the same is for the patients as well. I always look at it from the point of view that if somebody becomes a patient, they are already in a quite vulnerable stage in their life. They come to hospital and they go to practice. They don't know what they're going to hear. They don't know what's going to be, how her life's going to change or not. And on top of that, if they don't feel that the information is strictly confidential, that's kept in a secret and it's on a need-to-know basis, that adds up to their anxiety. So be aware of that, that only deal with the information that you have to deal with, access what you need to do for a level of your practice, and make sure how you carry out conversations related to that particular patient.
And we mentioned, didn't we, when we were preparing for this, we were talking about the people that you can ask for advice for. So there are data protection experts in every organisation who are always amazing to. I've certainly accessed at the HCPC our data protection expert. And if you're worried about anything, yeah, would that be somebody you would turn to?
Yeah, I think it's important from the, being a healthcare professional, you need to recognize the limitations of your knowledge, limitation of your understanding, let's just put it that way. So there's always people that maybe know it better, maybe they know how to approach particular issue. So always seek advice if you don't know how to approach particular aspect of this. There'll always be a data protection officer or GDPR liaison officer. Every organization will have one, so always approach them and ask for advice.
Yeah, totally agree. And I'm going to come to Patrick now, because I've been looking in the chat, Patrick, but is there any questions that are coming up or any comments you want to just pass on to us? Because I know it's quite difficult for us to see the comments as they're coming along, if that's okay.
Nothing so far, really, Kim. I think, yeah, everyone's just listening because it's quite a new topic, I think. Yeah. Thank you.
Thanks ever so much. That's great. Brilliant. So thanks ever so much for those comments, really. That's really, really useful. So this is what we expect at the HCPC of you as registrants related to particularly the standards of proficiency. So the standard of proficiency, my apologies. So it doesn't mean that we've all got to know about all the technology, because that would be absolutely crazy. There's no way I know about Dorota's technology, and particularly immunotherapy, I'd have no idea about at all. But that we've all got access to different technology-based settings and techniques that in our practice. But really, we need to think about directing our CPD to those new technologies. I'm going to talk about that in a second, and thinking about how we can integrate technology in our practice and how we need to. So this is what we'd expect on you with all the new standards of proficiency, that you reflect on them, that you assess yourself against them really, and think about whether you've got any gaps in your knowledge about these new standards of proficiency, and use those gaps to generate and inform your discussions and inform your CPD, inform your learning needs, can be part of your preceptorship, part of your supervision. If you're having supervision conversations, can sort of drive your supervision conversations. So that's what we expect of registrants. And it's important to think about this sort of gap analysis. What's the difference between what we know now and where we want to be with the new standards of proficiency, and how we want to get there is right in the middle. So we've devised a little template that might be useful to you, and we've called it the Standards of Proficiency Expectations template, and Patrick is going to kindly put a link to how you can download this template in chat, but it's just useful to guide your thoughts about the new standards of proficiency and think about where your gaps are in your knowledge about the new standards, not only particularly related to technology and digital, but all those 5 key areas that we've actually talked about. So the first thing is obviously read them for your chosen profession. All right, and actually look at them for your chosen profession, and look at where the changes have been made. In our new standards, on our new standards of proficiency pages, there's actually a document that says changes, and it actually highlights the changes that have been made to the new standards of proficiency, which is quite useful, I think. So that might be useful to you, and summarise them in this document that we've popped on, if that's okay. And think about which of the new standards you're fine about, and which are the new standards you need to do more about, but reflect on a situation where you've actually used the new standards. And this might be useful to you for your CPD. It's useful, for example, for your reflection after all of our standards sessions. So, for example, quite a lot of people have asked about certificates. We're not going to give you a certificate for this session, but what you can do is to prove you've actually been here and we've talked about the new standards of proficiency, is actually complete one of these templates and think about how you might use that template in your CPD, but also in your conversations with your managers. So think about the new standards, think about reflecting on a situation that might illustrate how you've used the new standards of proficiency. But really importantly, right at the end is this gap analysis. Think about where you might identify any learning needs, particularly related to those 5 areas for the new standards of proficiency, and identify any learning needs that you would actually need to complete. So, for example, you might need to go on some new training about some new technology that's being implemented in your department. You might want to think about who is your data protection link in your organisation. Who is that person that you would turn to in that situation if you were concerned about data protection, if you're concerned about confidentiality? You might need to go on some more training about data protection, about confidentiality. We've got a webinar that we did last year on confidentiality that you might need to access. Some things like that might be quite useful to actually specify some of your learning and development needs. That might be quite useful. So I hope that's a useful point. And I know there's been a couple of conversations, a couple of thoughts in chat, and I'm just going to read a couple of them out, if that's okay. And you might be able to help Dorota with the answer to this. So somebody said the confidentiality of a patient in consultation at the patient side is also important. And I think that's really important when you're having a chat with a patient and you're doing maybe a Teams chat with a patient. Where does the clinician's responsibility lay in ensuring your patient can maintain their confidentiality in their environments, particularly where there are safeguarding concerns, and where do clinicians stand with paediatrics, for example? And I know I've worked a lot with doctors who do quite a lot of remote consultations, and one of the things they always ask a patient right at the beginning of their consultation is, who's with you today? And they document that. And where are you? Have you got confidentiality in the situation that you're in? So, for example, if people haven't got internet at home, they might actually be in a local cafe or a local library, and it's really difficult for confidentiality to be maintained in those areas, and actually document those things. I think that's important. And then also safeguarding concerns where clinicians stand with paediatrics and informed consent, and where a child doesn't want a guardian or parent to be present. And I think, again, you've got to document that in your notes about that whole situation. Who is with the person and who's in the person's environment? Anything you wanted to add to that, Dorota? Is there anything you wanted to add to that?
No, I think I agree with you that, I think I would say in the situations that you're not really sure, always record what the situation looks like, because then maybe you can go and ask for advice. But my idea would be always that, if it's some particular situation you don't feel comfortable with, maybe it's time to ask questions and raise it up. Maybe it's something nobody ever flagged before, but it's something that should be highlighted somewhere and addressed properly. But the good starting point would be to record the particular situation as it happened, and then maybe ask for advice. Is this something that should be happening that way, or is it something we should be looking in depth? Maybe we get some advice from a specialist in this area.
And particularly somebody, like I say, if you've got safeguarding concerns, you can always pause conversations, remember, and say, do you know what, I'm just going to need to take some advice here, and then come back to you and have this conversation in tomorrow or next week, because I'm going to need to take some advice here. Nothing has to be done immediately often. So I would also, another fantastic person in the organisation, we did a safeguarding webinar last week, would be your safeguarding lead in any organisation to discuss some of those queries and questions. Is there anything else that I'm doing a professional doctorate in education, and my thesis is on the scope of AI knowledge required by allied health professionals. That's bizarre. I was listening to a programme on Radio 4 yesterday about AI, so any help and ideas are recommended. Radio 4 yesterday, about 10 o'clock, there was a great session on AI. Is there anything that you're involved in about AI?
Well, I think if we look into AI, artificial intelligence is nothing new, really. It's been here on the market for the 50, 60 years, but just recently it become a bit of a buzzword, really, that everybody attaches. And I would look into that, you know, AI doesn't mean it has to be something really, really complicated. Artificial intelligence is, for example, using a digital record. It's not super power computer. This all falls into the category of artificial intelligence. And I think the more we know about what we're working with, the better we can do it and the more safe we can do it. I think that's the key. And if there's something we recognize, like, listen, I don't have enough knowledge about it, just simply train yourself, ask for training, ask for some kind of a practice session, something that you can really do it from the right perspective and know exactly what you're doing.
And there's also some really good points about the professional bodies have some fantastic training, and I know lots of them do. So thank you, Dr. Carol. As mentioned, the art psychotherapy professional body that's got specific training on digital and the use of digital and technology modules. So thanks ever so much. If anybody else wants to add any other training that they've been on that might be quite useful in chat, that's always really nice as well. To mention those as well, so that's really good. Anything else I've missed, Patrick? Those are the ones that I saw.
Yeah, Kim, there's quite a few questions in here now, actually. So we've got one here from Devon Turner, who asks, can you offer any guidance on how to approach this as a return to practice professional who is not currently in a relevant role and will only doing 1 day a week as a band 3 in a relevant role? They give an example, a therapy technical instructor for return to practice physio. There's another person who's also a return to practice registrant as well, so that'd be helpful for them.
Yeah, so I think I would say what a fantastic and wonderful that you've returned to practice. So thank you very much for returning to practice and being part of the healthcare workforce. And I think what I would be talking to is other members of the multidisciplinary team that you work with and asking them what technology and digital skills that they've got and how they got them, and then trying to hook onto some of the training that they've done or that they would recommend. I think there's always things like training that people recommend is always really nice. That's for me would be the most important thing. And have you returned, done any worked with any return to practice colleagues, Dorota?
No, I haven't, but I think we should look into that from perspective somebody like a new employment coming back as a new registrant, let's just say. So every workplace, I would imagine, should have some kind of an induction training, and all those aspects with the technology should be included in it. If there are not, I would just simply ask for it, because if you ask to work on a particular piece of equipment or software, you should have a relevant training to actually that would deem you competent to use it. So that would be my starting point. Well, depending what kind of a training you need, I think it will be worth to search the market as well. There's a lot of trainings that you can actually access for free. It doesn't necessarily has to come with the cost. But I think the starting point would be to come back to your employer that you have a contract with and actually ask them, what about this? I haven't worked on that piece of equipment or that software before. I would like to have a training that will have to be documented, that you actually had the training and that you deemed competent to use it.
And Fiona, have you got anything you wanted to add? She's just stalled, which is horrible when she's just about to say something, isn't it, really? Oh, Fiona, I think you've stalled. I'm really sorry. We'll come back to you if that's okay as soon as you get your internet back on. And there's another question from Florence about lots of issues about using monitoring tools for dementia, which keeping people independent, which is fantastic. But we are leaving them too long before we put in other forms of intervention. And why are we leaving people with these needs alone when they may be better off with alternative living solutions? So I think if you're concerned as a registrant about, you know, that the monitoring tools are out there in practice with a particular patient and you're thinking that actually they've got other needs and actually there's other things that we need to be doing rather than leaving the monitoring tools in, then it's up to us as registrants to raise that, isn't it, really? So that would be really important. It's about raising that with your manager to say that actually you don't think this is meeting the person's needs, that there are other things that we need to be doing. Fiona, I'm going to come back to you again. I think your internet's playing up. I just heard you speak. Oh, she says it's not. It's behaving very badly today. I can see that.
Can you hear me now, Kim?
We can, Fiona, yes.
Hello, Kim. I've written in chat now, so this is now very out of date. But I just wanted to draw attention to some of Amy Robertson's comments in the chat, because she's talking from an interesting perspective really about the value of doing gap analysis in group discussions and team discussions and coaching, mentoring or supervision. So that's led to some really interesting sort of spin-off conversations. Just the fact that gap analysis can be difficult to do alone, because if you don't really know, you might need help to identify where the gaps are, but also to be able to plug those gaps and fill those gaps. Well, not plug them, that's a terrible expression, but to fill those gaps, you need to harness the knowledge from others. I thought that was really interesting. Thank you very much for that, Amy. And
there was a conversation, I remember it was Amy talking about coaching conversations, which could involve doing a gap analysis, which was, I just picked up on, which thanks ever so much for that. This is what's so great about often webinars, isn't it? We can all learn from each other, which is fantastic. So I'm going to move on just because we've got 4 minutes left of our webinar. So I just want to finish off with just a few other resources, and then we'll take questions if that's all right. So just wanted to flag professions that are currently in renewals, just useful to mention those today. And I'm going to go to one more polling if that's okay, which is asking you now to rate your understanding of what the new standards actually say about technology and digital. So I'm going to ask you to do that if that's okay. You should be able to see these results. Yes, I'm sorry why you couldn't see them before, so I do apologise for that. But they're coming up, and it looks like quite a few people are saying they know a little bit more, which is really useful as well. And while people are voting, I'm going to just go back up to the questions, because there's a couple of questions. I'm a first contact physiotherapy practitioner who's involved in lots of telephone consultations with non-English speaking patients, and sometimes there's a family member or friend there who's helping with interpretation. How can we ensure confidentiality? I think the most important there is that we can't rely on friends and family to be interpreters for our patient discussions, so we need to book proper interpretations services that are available, certainly in the NHS, and a lot of private organisations actually use what's called buy interpretation services. So it's really important that we pause that consultation and get some interpretation services, because it's really important that we don't rely on friends and families to interpret in situations. Is there anything you wanted to add to that?
I just wanted to say that in those situations, sometimes really tricky, because we have a patient coming with the daughter or somebody who's going to, interpret for them. It's difficult, but I think that should be addressed whenever a patient is being booked, that, we would prefer to have an interpreter, because I was actually in a situation a few years ago that, I had a lady who couldn't speak English, and her teenage son was offered to be interpreting things which I was clearly going to ask quite sensitive questions, and I just said, well, I'm sorry, I can't carry on. So I think as a professional, you need to make that decision sometimes, that I don't think we can carry on. We need to have an interpreter who I can be sure that the information is properly relayed to the patient as well. So, but I think it's a decision as a healthcare professional. You need to make sometimes the decision that, I'm sorry, in a situation like this, we need to have an interpreter. If you need to, it's somebody who's not related to you, or whatever way we approach it. But it's relying on family, friends, or even children. It's a tricky situation, and the best probably is to avoid it if possible.
Yeah, thanks ever so much. So a couple of points just before the end was that 2 days ago we launched, or 3 days ago we launched the consultation on proposed changes to our fees. So we really want to hear your thoughts on our proposals, and we'll pop the link in chat, because there's lots and lots of information on our website about the new consultation. I wanted to plug the other events. As usual, I'm always going to plug the other events, aren't I, that we're going to run in this series, because they're just useful to us. Useful to you, and you can sign up to those anywhere in chat. Patrick will put those things in chat for you. And as a last 2 minutes before the end, if possible, if you could possibly again in chat, we're going to put the link to the survey that we asked for today. It's really useful for us. We get really good feedback, that enables us to allow to change things in sessions for you. So we really would appreciate the time. It literally takes 2 minutes to do our survey, and I would really appreciate it if you'll possibly do that for us. It will be really, really useful. So I'm going to pop both the QR. You literally put your phone up to chat, and we'll do that for you if that's okay with you. And I'm hoping that we've put most of the links in chat, but we will make sure that if we haven't, we'll send you out afterwards the links for all the things that we've talked about, to make sure they're really clear. But it's really useful to do that. And I know that Patrick's put our email in already, so thank you very much, Patrick. And I'm going to finish with a massive thank you for my colleague Dorota for being part of our session today and answering lots of really difficult questions, and also sharing your experiences and your role as a clinical scientist, because I've certainly learned a lot today, and heard a lot about what you actually do, which I actually really enjoyed hearing about. So thank you very much for giving up your hour or your 3/4 of an hour for us today. And if I want to finish on the last request, just to do our survey in chat would be super useful. And I hope that you join us for our next webinar, which is next week on service user engagement. And we'll look a lot about what the new standards say about service user engagement. Thanks very much for your day.
And could I just say the next webinar is leadership.
Leadership, my apologies, Fiona. Where did that come from?
Don't overpromise.
And underdeliver. Brilliant. Thanks ever so much, everybody, and take care and enjoy the rest of your day.
Thank you.
Thank you.